Um, Welcome back, everyone. This is our next installment in our Spotlight series in women's health that we're doing with Catalyst Physical Therapy. I'm super excited today to introduce you to my colleague, Dr. Yogita Tailor. Dr. Tailor is a physician at Pelvic Rehabilitation Medicine here in Atlanta. She received her undergraduate training in Baltimore, Maryland, and her medical degree at the University of Medicine and Dentistry in New Jersey. She's a DO who is also a trained physiatrist, and she and I have been colleagues here in Atlanta for quite some time. She's doing amazing work working with women and men who experience pelvic pain, and she's in a very unique practice. So I will let her kind of describe what she does. Welcome, Dr. Tailor. It's so great to have you here.
Thank you so much, Blair. It is awesome. It's been wonderful working with you, and I'm glad we're doing these sessions. I think, again, lots of tools for our community to have. And again, yes, I'm a physiatrist, so a specialty where we kind of focus on function, similar to a physical therapist, but from that medical standpoint of it. We treat nerves, muscles, joints, and again, it can go from the musculoskeletal to even the neurological aspects. But my current career, I'm primarily using what I learned from physiatry to treat chronic pelvic pain, both in men and women. And it's very rewarding, and it's been wonderful to share patients with Blair and just share, common experiences
Yeah.
with Blair. Yes.
Yeah. So I have to ask you because
Yes.
I get asked this question all the time. What led you to working with people who have pelvic pain?
Yes, it was a gradual turn of things. Honestly, when I was in medical school, I thought I was going to go into some kind of specialty that people know about, cardiology, pediatrics, but I didn't feel like that was a great fit for me. Physiatry really felt like, hey, this is appropriate. I'm focusing on function. And then as I grew my career in physiatry, and I saw patients with back pain and hip pain and pain in the groin that wasn't fitting the traditional orthopedic sports medicine avenue of
Yeah.
this. Plus, I have children, pregnant, you see pregnant patients who have pain, postpartum patients. I was like, there's a missing aspect of the care I'm giving. And that eventually led me to where I am. Initially I was seeing just pregnant postpartum patients, but now I see, again, both men and women who may be dealing with pelvic pain from multiple different reasons. And it can be from disease processes like endometriosis, which is probably a big component to percentage of patients that I see. But again, sometimes it's an injury, sometimes it's postpartum, sometimes it's more, urinary discomfort and things like that. So our goal is to help put the pieces together and get things calmed down as much as possible.
Gotcha. So can you explain to our audience? Obviously, you describe that. I'm like, wow, you sound like you do exactly what we do, but you're very different, right? You're coming at it from a physician medical perspective, where we're
Yes.
coming at it from a physical therapist perspective, which is great because I think the two fields really kind of marry together nicely. Can you kind of describe what you would do that's maybe different from what we would do as physical therapists or what a patient might experience in PT, and then how you work with PTs to help patients get results?
Absolutely. Again, there is a big overlap. It's just the different tools in our toolbox. So,
Yes.
some tools that we're working on calming down both nerves and muscles of the pelvic floor. That's a general aspect of what we both want to do for our patients here. But my tools are just a little bit different. So, tools can include injections. We can do injections targeting the nerves and the muscles of the pelvic floor. Sometimes it's medications, including muscle relaxants, nerve medicine. Sometimes it's, again, just seeking a different approach and seeing, hey, is there a rheumatological component to this? Is there a different neurological component? Do we need to get imaging? Do we, just kind of helping to figure out the next steps
Right.
in terms of getting patients together and better. And again, working together, again, sometimes when Blair does her treatment, which can be manual or dry needling, and we incorporate our treatment, which can be injections, doing it together re-emphasizes to the patient's body, hey, this is what we want to feel. This is, and it's more about retraining that body. And so having a different approach helps to kind of amplify that goal.
Yeah, and I think you bring up a good point there because what I found is when my patients work with you or people like you, they do so much better because we're able to calm down their body, calm down their nervous system, which lets us introduce things in more. I think even as PTs, I think the mistake we make sometimes, certainly I've really evolved, I think, through my career is we need to do all these PT interventions. We don't need this other stuff. But what I'm finding is the sooner we can get our patients medical management and the sooner they have those interventions as well, they do so much better with PT. It's like it just keeps the whole thing moving
Yes.
much more quickly in a much more positive direction. And so I find myself referring out probably sooner rather than later when it comes to patients with chronic pain. So I don't know if you see that too, but that's what I see.
I absolutely agree. A
Yeah.
patient who's been dealing with pain for several months is going to respond a
Mhm.
lot better than someone who's been dealing with pain for several years and decades. And it's
Yes.
the way the nervous system is
There.
communicating with each other. Like the brain, there's like nerves are like this. Everything influences the other, and by kind of doing it together, we're targeting upstream as well as downstream, and so the response is better.
Yeah.
Yeah, and it's goal is to get our patients better faster.
Oh, 100%.
Yeah.
So we know pelvic pain is it's a very sensitive subject. It's something
Yes.
people don't feel super comfortable talking about, or sometimes they want help, but they're scared. So what would you say to someone if they came to you and they were scared, they weren't really sure about kind of moving forward with treatment? I think one thing you do really well, and one thing I really like about you is what I hear from my patients is you really put them at ease. So what's something you would say to a patient to help them feel at ease about getting help for their pelvic pain?
Absolutely. And again, we want to create a safe space for our patients. So, much of that first appointment is talking about, hey, what's going on? What have you gone through? What have we tried? What have we not tried? But also then kind of looking at factors that we may not necessarily be thinking about that may be associated, even things from work and life stress, activities, exercises. So we do kind of, always ask, so I want to hear your journey regarding this. And again, based on that, again, we do a full neuromuscular exam, and not all of that neuromuscular exam is as invasive or intimate as one might. I always start with the back, the hips, the
Yep.
abdomen. Again, all of that is part of the pelvis, right? And it can
Yep.
influence even things like pain with intercourse. Then we do an external exam. And then again, if as long as the patient is okay and is consented, we'll do a quick internal exam. And that gives us a good picture of how things are. At any point, if the patient's like, no, we want to stop, we want to pause, absolutely. And then based on that, we can talk about all the different options, and the options can the options are there depending on their treatment, but we can do whatever they feel ready to start. At the end of the day, most of the things we treat are not life or death, which is amazing, but at the same time, it's a quality of life. And at the same time, if certain things stress people out, we don't have to proceed right away, and you can think about it. We also do offer a phone consultation. So if you want to talk to me on the phone first and kind of get that aspect kind of inlay, we also allow for that, so that way you can kind of do it at the safety or the comfort of your own home, and then we can see you in person and just to figure out if this is a good
Yeah.
fit for you.
I didn't even know you did phone consultations. I
Yes.
learned something new today. That's awesome. I'm gonna remember that one because I think my patients would feel a lot more comfortable
Absolutely. Like when,
having a phone call first. So yeah,
yes.
I absolutely love that you guys do that.
Yeah.
Do you have a favorite kind of type of patient or a favorite diagnosis that you work
Yes.
with?
The most favorite type of patient is one who's motivated to do the work, right? Again,
Yeah.
a lot of the times treatment can be things that I do or you do, but there are going to be things for the patient to do on their end. And if they're motivated and willing, and those things can be some of those easy, basic things we hear about all the time between nutrition, movement, doing home exercises, it helps because at the end of the day, I will see you for a very small slither of your day or your month, but it's how you feel on a day-to-day basis. So sometimes I want that patient to be doing that mindfulness, that work at home in order for us to have that best long-term success. Diagnoses that are fun to treat. Again, I always love my postpartum patients and hearing about the babies and all of that. But again, I have men and women that intercourse is difficult or painful. And again, we want the patient to be comfortable and we want the patient to be able to achieve the goals. So like I said, the best patient is the one that's motivated to be going through the whole process with us.
I love that. Yeah. And I agree. It's definitely a team effort that is doctor, PT, mental health professional,
Yes,
and patient and whomever else they need, a partner, whoever else they need to pull in on their
absolutely.
journey. So I think you make a really good point there. And you reminded me, I think we actually met at a pregnancy conference. I was
Yes,
trying to remember. I'm like,
yes.
how did we meet?
Back
And I
like
think it was like during
Emery.
COVID, I feel
It was
like at
during
Emory.
COVID. It was,
Yeah.
yes, through Zoom just like this, but it was
Yeah.
years ago. Yes.
I was trying to remember, and then you were talking about postpartum. I'm like,
Yes.
that's how we met. Okay, so my final question:
Yes.
if someone was going to come see you, so a potential patient's going to walk in your door,
Yes.
what's something you want them to know about you,
Yes.
um, to kind of
So
help?
again, I love to talk through everything. And again, we want to put things at ease. Again, I love talking whether nails. I love talking about fingernails with my patients because many of my patients come in with the most amazing nail polish. So if you have some fun nails or even socks, fun thing. But otherwise, again, I want to put the patient at ease. You know, if you
Yeah,
want to come in with a partner or someone, we welcome that. If you want to come talking about travel or your babies, we'll talk about that too. But at the end of the day, I always want to make sure whatever's the most comforting aspect for the patient is our goal. Um, so those are the big things. Again, if you want to talk about Backstreet Boys, I can tell you, I'll rank you my favorite Backstreet Boy.
now that's my next question. Who's your favorite?
I
That's
so
amazing.
I always found Kevin Richardson to be the
Okay.
cutest, but I love the voice of AJ McLean.
I love it. I
Yeah.
love the Backstreet Boys. That's great. And that's one thing I love about you is your ability to make, like I said, your ability to make people feel so at ease. And that's what I love about you in particular. But then in general, just knowing that this is a person and not just a diagnosis, I think is so helpful.
Yeah,
So
absolutely. I think that's the hard part
yeah,
about this. And people want that diagnosis, and this diagnosis is treated by this. When it comes to pelvic pain, it's like
there's
this.
so much.
Yes,
Yes. And there's that person behind it that if you don't get to know that person, it's
absolutely.
going to be really hard to get the problem better. So
Yes. Yes.
awesome. Well, thank you so much. This was so
Absolutely. This
great.
was so wonderful.
I will make sure for those of you watching, I will link up Dr. Taylor's website so you have her contact information and their social media for pelvic rehabilitation medicine so you know how to find them here in Atlanta. And if you're not in Atlanta, they actually have other locations as well so they can help you find a physician where you live. Dr. Taylor, thank you so much. This was amazing.
This was amazing. Great to see you, and thanks for coordinating this.